This skill is Intranasal Medication Administration. So coming up to my patient, BSI, scene safety, using standardized precautions. I'm going to come up to my patient, assess my patient, get my general impression. So, sir, ma'am, what seems to be wrong? I can maybe see that their work of breathing is increased or decreased. That could be one reason, or maybe they're feeling nauseous, so I can give Zofran. That is the medication that I have here right now. So I can see that I do need to administer ondansetron. My medical director or my protocol book will tell me the correct dosage. So I'll come up, I will make sure that I have the correct vial. I'm going to make sure that it's clear, that there's no discoloration to the vial, that I have the correct medication, Zofran, ondansetron. I'm going to make sure that this is my patient. I'm going to make sure that once I deliver the medication, I'm going to assess the time, and I'm going to make sure that I give it the right route, which is intranasal via mat device and syringe. So coming up to prepare my equipment, I'm going to have my sharps container. I'm going to have my needle, my 3 ml syringe to withdraw the medication. I'm going to have an alcohol prep and a 4x4. So now I'm going to come up to my medication. I'm going to place my 3 ml syringe and lock on the needle. So I'm going to keep the needle within the packaging. I'm going to twist the needle on, securing it, making sure that I continue to use aseptic technique or sterilized procedure. So now that I have the needle with the cap, I'm going to place that down. I'm going to once again look at my medication, making sure that it is Zofran, the correct dosage that I will be given, that it is clear, and that I will be giving it to this patient the right route via that device. So now I'm going to remove the cap. I'm going to grab my alcohol prep. I'm going to grab the vial. I'm going to work inwards, working my way out. Just cleaning off the surface of the rubber cap. So once that is clean, I'm going to continue to hold this in my hand. I'm going to remove the cap of the vial, maybe set it down. Now I'm going to have this needle that is showing. So I'm going to also have the appropriate amount that I'll be withdrawing from the vial. I'll have full of air to push into the vial, so that way I will not have any negative pressure within the vial. So I'm going to carefully insert the needle into the vial, pushing that air in. Now I'm going to withdraw that same amount of medication. If I have any air bubbles, I can kind of flick it or tap it, pushing that air back into the vial, making sure that I don't have any air bubbles in my syringe. So I'm going to withdraw the correct amount. I'm going to remove the vial. I'm going to set the vial down. With my needle, I'm not going to recap it or anything. If I do have to recap it, I will then place the cap on the counter, sweeping my hand forward to recap on the needle. But in this instance, I'm going to have a sharps container. So here's my sharps container. I'm going to place this on the counter. I'm going to sweep, placing the needle inside, twisting it off. Now it's in the sharps container and secured. So I have this medication right here. I'm going to open up the mat device. I'm going to place, still using aseptic technique, place the mat device on. Okay, now I'm ready to give my medication. So once again, I'm going to make sure that I have the correct medication. This is ondansetron or Zofran. Okay, the correct route is via intranasal via mat device. I'm going to look at the correct time. Okay, once again, this is my patient, the right route, the time. Still noting that there's no discoloration to the contaminants. Also noting the date on the vial, making sure that it is in date and proper to use. Okay, so I'm going to explain to my patient what's going to happen. So, sir, ma'am, I'm going to insert this foam-like piece into your nair, which is your nostril, and I'm going to push in. If it takes a couple times, that is okay. Okay, so I'm going to assess the patient's nair, noting which nair is the largest or does not have any obstructions within it. So I'm going to place this medication or this MAD device with the syringe. I'm going to place it in his right nair, knowing that it is more susceptible to being larger. Alrighty, 1, 2, 3. Perfect. Alrighty, how about another? 1, 2, 3. One more. 1, 2, 3. Perfect. Alright. So I have administered this patient Zofran with the MAD device. I'm going to assess the patient whether I need to look for his work of breathing. I will listen to his lung sounds. I'll assess the patient for any adverse or desired effects. So I will then go ahead and listen to his work of breathing, make sure that it did not decrease or increase too much. All right, take a deep breath for me. Breath. 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 Go ahead and do one more. Breath. Alrighty. So I'm going to continue to observe my patient, continuing to note any signs of positive or adverse effects throughout this entire process.